Okay, this is Jeff with the YouTube channel DSH-ABUSE. Today's date is July 25th, 2020. Charles, what's your last name?
My name is Jackson.
Jackson, Charles Jackson. You consent to being recorded, correct?
Yes, sir.
Okay. And you're at Patton State Hospital?
Patton State Hospital, yes.
And you're on Unit EB09?
Yes.
Okay. The first thing I want to ask you about is, and I'm going to be very brief here. You're telling me that you're having side effects to your medication. Tell me about that real quickly.
Well, I have been, for some years now, I've been having side effects from the medication, from the psych medication, which caused me to see black spots in my eyes. I lose all control of my eyeballs, focus, focus.
Okay, what I want to talk about is what side effects are you currently having, like say currently having and what you're having recently. Okay, I don't want to talk about the past few years. What are you currently having right now?
Spots.
Spots in your eyes.
I see spots.
Where do you see those spots? In the distance or like
on walls? On walls, on the ground.
Okay.
And
you reported this to your doctor, and they've given you they call it side effects. What has the doctor told you?
The doctor has given me side effects medication, which can counteract the chemicals in the medication.
Okay.
Yet still the side effects are still there.
Okay. Now these are not hallucinations. These are they told you that they've told you that these are not hallucinations. That these are actually side effects. Correct?
These are actually side effects. Yeah.
Okay.
Correct.
What medication are you on that you know of?
I don't even know what I really don't know what medication that I'm on.
Well, you had mentioned before we started this recorded interview. You had mentioned Zyprexa.
I think it's Zyprexa, yeah.
Okay, so
I know they had me on Prolixin. They had me on Prolixin. They had me on Thorazine, Houndol.
Okay.
I mean, I've been doing this for years now.
Okay. Now, what do you know that your diagnoses are? Mental diagnosis. Paranoia, schizophrenic, bipolar disorder. Okay. Anything else?
That's it.
And you are known to have. Do you ever hear voices, or do you have hallucinations?
No, not really. Only when under the influence of marijuana, okay. I was hearing somewhat of voices, but never seen anything. Okay, but when you're not using illegal drugs or anything like that, I'm A-okay. Oh, you're A-okay. So, as far as you know, okay. Yeah. All right. Well, I'm going to email this audio file to the director of state hospitals. We'll get this out today, and we'll report this on your behalf. Okay. Okay. Can I say? Yeah. Go ahead. Go ahead. Say what you're gonna say. Oh, the other thing I want to ask you about is you're on EB09, where they took the phones away from you. Now, you had mentioned that you were out to the hospital, and we're going to interview some other guys there this morning. But to your knowledge, the phones were taken away, the incoming phones, for about a month. Is that your knowledge? Yes, sir. Can you describe that to me? Real briefly, can you describe that? Well, as I was on the unit, everything due to the coronavirus was shut down. We had to stay in our rooms. Showers was monitored, and the phones was off the hook. We could not use the phone for I think a month or two. A month. Okay, so the staff took the phones off the hook. Exactly. And you couldn't use the phone. Couldn't use them. We're referring to the incoming phones. You don't know about the outgoing phones. No. Do you? No. Were you guys allowed to make outgoing phone calls? Do you know? No phone calls, period. No phone calls, period. That was before I went to the hospital. Now, when I went to the hospital and I came back, that's when I noticed that people was using the phones.
Okay.
Now they started to let us go to the courtyard.
Right.
So we going to the courtyard.
Okay.
So.
Right. How long were you out to the hospital?
I was out to the hospital for 2 weeks.
Okay, what was that for?
The coronavirus.
You went out for the coronavirus?
Yes, sir. Almost died.
You were tested positive?
Yes, sir.
Are you serious?
Yes, sir.
Did you go to EB11?
Yes, sir.
Oh, you were?
I was down there.
On EB11?
Yes, sir.
Did they have the phones off the hook over there?
Yes, sir.
Oh, wow, I didn't know that.
Yeah.
You gotta be kidding me.
I was there.
So what was it like on EB11?
Well, breaking up again.
How many people on EB11?
Very few. Very few. At first, it was like probably 6, 7 guys. Then what they started doing is they started sending the guys back up to the units.
Right.
So
when you say
then
very few, what's very few? What's very few?
Huh?
What's very few?
Well, 6, 7.
6, 7.
Yeah.
And your families couldn't even call you. You couldn't use the phones over there.
No.
I tried to call over there. They got them off the hook apparently over there as well. That's incredible. You know, I'm really appreciate you talking to me. Listen, I need to get this out. We're going to email this out right now.
Yeah.
As far as I know, I mean, they don't have the right to do this. It's absolutely incredible. I thank you for talking to me. And we're gonna, you know, if they feel it's unsafe for you guys to touch the phones, they should be making speaker phones or something available. So we're going to try to make.
Let me tell you this, Jeff. There was one guy who was an elder guy, and he was kind of disoriented. He's still laying in the bed, kind of sick. Well, a lady brought a cell phone and called his family so he could be able to talk to his family over the speaker. I witnessed this.
Okay.
She had a cell phone, and so he was somewhat speaking to his family over the phone. So it's not like, I don't think it's like they intentionally said we can't use the phone, but I think it was based on the if you really need to speak to your family, we can assist you with that.
Well, this was on EB11?
This is on EB11.
Okay.
But the phones I'm talking to you like right now was off the hook. You couldn't use those.
Well, I've been trying to call EB11. I contacted the executive director's office yesterday.
Yeah.
They have. They have no knowledge that the phones are off the hook. They did not make me aware that I could call somebody on a cell phone. There's no procedures, I'm sure, that are written about this. So, did they ever advise you that if you wanted to make a phone call, that they would bring you a cell phone?
Never,
okay.
never.
So that's what I'm talking about. Maybe his family raised hell. This is the thing with the hospital. They're not advising you. So did they say, Mr. Jackson, we've taken the phones off the hook. If you want to make a call, we'll bring your cell phone?
No, it never said that.
Exactly. And we need to get this fixed. Man, I'm so glad that I didn't realize that you were the guy that I needed to talk to.
Well, I'm actually, when the unit is running, I'm actually the president.
Really?
I'm the president of the unit.
Let me ask you another question.
Yeah.
You ever see patients picking up dirty laundry on your unit?
Yes, sir. That's Mr. Elijah Walker.
He told me that it stopped. That it's not happening anymore.
No, because this coronavirus.
Right. So the staff are doing that on your unit now.
Yes.
Is that correct? Okay. Well, that's good because we have reports that it's going on in many other units at Patton. We've done interviews with patients. So I'm glad that at least that's happening on your unit. The staff are doing their job in that regard. Listen, So we'll give them credit for doing that. But on other units, they're paying them. One guy, they paid him a bottle of soda. They're paying him coffee, patient's coffee. So listen, we need to get this out right now.
And it's dangerous too, because you can catch germs.
Yeah, exactly. Well, listen, we need to get this out. Your families need to be able to call you, especially on the coronavirus unit. You know, the families need to be able to call patients, and if they feel it's dangerous to touch the telephones, then they can make speaker phones available or cell phones. So, listen, thank you very much. I'll be back in touch with you, and I'll keep but to get updates on what's happening. Okay? Thank you so much.
All right, Jeff. You have a good day.
Yeah,
it's nice to talk to you.
This was recorded as you gave me permission in the beginning, and we're going to email this audio file out within the hour.
Do you need my patient ID number?
Yeah, what is it?
167530.
Is that a -5?
Yeah.
Okay, say it again one more time.
167530-5.
Okay. All right, buddy. Thank you very much.
All right, Jeff. Thank you.
Bye-bye. Bye-bye.
Bye.